Hi, in this video, I'm going to talk about how you can keep your hypertension in check, help to realize the sign to prevent it on the right time. As you can see, about 1 in 3 adults in the US has high blood pressure, but many don't realize it. High blood pressure is sometimes called a silent killer, because it usually has no warning signs, yet it can lead to life-threatening conditions, like heart attack or stroke. The good news is that high blood pressure, or hypertension, can often be prevented or treated. Early diagnosis and simple, healthy changes can keep high blood pressure from seriously damaging your health. However, normal blood flow delivers nutrients and oxygen to all parts of your body, including important organs like your heart, brain, and kidneys. Your beating heart helps to push blood through your vast network of blood vessels, both large and small. Your blood vessels, in turn, constantly adjust. They become narrower or wider to maintain your blood pressure and keep blood flowing at a healthy rate. Thus, it's normal for your blood pressure to go up and down throughout each day. Blood pressure is affected by time of day, exercise, the foods you eat, stress, and other factors. Problems can arise, though, if your blood pressure stays too high for too long. In fact, high blood pressure can make your heart work too hard and lose strength. The high force of blood flow can damage your blood vessels, making them weak, stiff, or narrower. Over time, hypertension can harm several important organs, including your heart, kidneys, brain, and eyes. You see, hypertension is a leading risk factor for death and disability worldwide. High blood pressure raises the risk of having a heart attack, heart failure, stroke, or kidney disease. Anyone, even children, can develop high blood pressure. But the risk for hypertension rises with age. Once people are in their 60s, about 2/3 of the population is affected by hypertension. Excess weight or having a family history of high blood pressure also raises your risk for hypertension. Because it usually has no symptoms, the only way to know for sure that you have hypertension is to have a blood pressure test. This easy, painless test involves placing an inflated cuff with a pressure gauge around your upper arm to squeeze the blood vessels. A healthcare provider may then use a stethoscope to listen to your pulse as air is released from the cuff, or an automatic device may measure the pressure. If your blood pressure falls between normal and hypertension, it's sometimes called prehypertension. People with prehypertension are more likely to end up with high blood pressure if they don't take steps to prevent it. But if you're diagnosed with high blood pressure, your doctor will prescribe a treatment plan. You'll likely be advised to make healthy lifestyle changes. You may also need to take medications, and the goal of treatment is to reduce your blood pressure enough to avoid more serious problems. Question is, how low should you aim when reducing your blood pressure? The answer depends on many factors, which is why it's important to work with your doctor on blood pressure goals. Most current guidelines recommend aiming for a systolic pressure below 140. These medical guidelines are sometimes adjusted, as new research is reported. A large study recently found that there may be benefits to aiming for a much lower systolic pressure 120 or less, instead of 140 at least for some people. The study looked at adults ages 50 and up, who had increased risk for cardiovascular disease, but didn't have diabetes. Half aimed for a systolic pressure of 120, and the rest aimed for a pressure of 140. That's the end of this video. Thanks for watching, and don't forget to click the links in description below to learn more about the natural treatment for your hypertension, help you to quickly lower blood pressure.